Good evening, everyone. Welcome to our session today on My Health Record in Aged Care and Allied Health. My name is Priyanka, and I'm the Allied Health Integrations Program Officer here at CESPHN. Also joining us today from the PHN is Carol, who is the Digital Health and IT Support Officer for Aged Care. We also have Yvonne, our Digital Health and QI Manager, and as well as Christina from the CPD team. Thank you all for joining us today. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize their continuing connection with land, water, and community, and pay my respects to elders past, present, and emerging. I would also like to extend that respect to any Aboriginal colleagues joining us today. Just a little bit of housekeeping. Today, we're going to use the chat function to ask any questions. And also this webinar will be recorded and an evaluation survey link will pop up on your screens at the end of the session. Here are a couple of upcoming events. We do have a PCA webinar next week. If you'd like to register for any of these events, you can find these on the CESPHN website. We have an exciting agenda today lined up, focusing on the key learning outcomes. We'll begin with an introduction to CESPHN, providing insights into our organization and its role in the healthcare sector, followed by an overview of RACFs and allied health in the CESPHN region. Moving forward, we'll explore the benefits and features of My Health Record. We'll also discuss how My Health Record how to access My Health Record and the conformant software. Additionally, we'll provide a brief update on the My Health mobile app. And lastly, we're excited to share the details about our Core Plus offer that's tailored specifically for the allied health professionals. So who is CESPHN? Central and Eastern Sydney Primary Health Network caters to a population of 1.5 million people spread across a vast 587 square kilometer area, stretching from Bondi to the Sutherland Shrine in the south and reaching as far west as Stratfield. This includes the population of Lord Howe Island. Projections suggest that by 2031, our population will exceed 1.9 million, with a notable increase in the individuals aged over 65. Just a breakdown of our service profile. Within CESPHN, we oversee 148 RACFs and 3,224 allied health. Presently, there are about 155 RACFs that are displayed on the screen, although we have had some closures and movements in the industry since our last profiling. Regarding allied health, we have identified 3,224, but the actual number is close to 12,000. In addition to RACFs and allied health, we also manage 577 general practices, 1,871 specialists, and 494 pharmacies across 2 local health districts, Sydney LHD and Southeastern Sydney LHD. This webinar aims to introduce RACFs and allied health to My Health Record system. Our previous interactions with this group have highlighted the lack of familiarity with the system. And over the years, we have collaborated with general practices, specialists, and pharmacies, offering them support in digital health. And they have embraced the system, integrating it within their daily workflow. It's just that RACFs and allied health are the missing piece of the puzzle. And it's important that we understand the benefits and functionality of My Health Record, and everyone needs to be on board for the system to work. Handing it on to you, Carol.
Thank you, Priyanka, and thank you to everyone joining us tonight. So let's begin with an introduction to what is the My Health Record. It is a secure online summary of an individual's key health information. An important element of the system is that it's personally controlled, and what this means is that an individual has a say as to what gets uploaded, what stays in their record, and who can see their record. More importantly, it forms part of a national system, so the individual's My Health record travels with them wherever they are and no matter which registered healthcare provider they are seeing. A patient or resident's My Health record is accessible at all times by them, their representative, and their healthcare providers. The patient's record can be viewed and information can be added. However, this is subject to access controls set by the patient, which we will touch on a bit later on in this session. My Health record is private and is protected via legislation, the My Health Records Act 2012. It is secure through multiple layers of international best practice in IT security. So in short, there is a cybersecurity team which monitors, maintains, and improves the system 24/7. To give you the latest information from December 2023, more than 23.7 million Australians have had My Health records, with 7.4 million of them being in New South Wales. Additionally, there is over 1.1 billion documents in this system being uploaded by consumers and healthcare providers. Within our region, public hospitals in both Sydney LHD and southeastern Sydney LHD, GPs, specialists, and pharmacies are actively uploading clinical documents as part of their everyday practice, meaning that there is a lot of valuable health information in your resident or patient's My Health record, and this could be very useful in your everyday practice. As you can see, 99% of pharmacies and GPs have registered and are using the My Health record system. In comparison, only 33% of RACFs across Australia have registered for My Health record, and only a small percentage of 6% are using the system. As of now, we do not have the figures for allied health providers, but we do know that both are probably quite new to the My Health record system. As allied health providers and RACFs work closely together, understanding the My Health record system can help healthcare providers better understand their patients working in aged care settings. Additionally, a recent Allied Health Digital Readiness paper published in June 2023, which involved consultations with allied health peak bodies and professionals, revealed a positive sentiment towards the adoption of digital systems and participation in My Health record. Over 30% of the survey respondents agreed that there is a positive role that digital technology has in supporting the delivery of quality and efficient care for their consumers. As you can see, there is a strong interest from allied health professionals wanting to be more involved in My Health record. If you are interested in reading this paper, we are more than happy to provide the link after this webinar session. Furthermore, the Australian government's response to the final report of the Royal Commission into Aged Care Quality and Safety have also recommended improving the transition between RACFs and hospital care, and also the adoption of digital technology and My Health record by the aged care sector. Now I have a short video for you all to enjoy. Please sit back as I present this video, which highlights the key components of the My Health record system.
My Health record is a secure online summary of a person's key health information. This includes information from GP records, pathology tests, diagnostic imaging, hospital records, Medicare, prescribed medicines, and information uploaded by individuals themselves. Making sure that you can quickly gain an understanding of a person's health history can assist in the treatment of chronic and complex medical conditions, reduce medication errors, and prevent the unnecessary repetition of tests. This all helps you to focus on the person, rather than looking for the information that you need to treat them. My Health record can save lives and improve patient safety by protecting against potential errors. These may be caused by needing to make clinical decisions without knowing a person's history. If you're authorised by your organisation and you are involved in a person's health care, you can view and upload information into their record. This not only allows you to access any information that has been uploaded by other healthcare professionals, but also allows you to upload healthcare information you have recorded. This helps to ensure that the person's key healthcare information is available when needed.
Now, as you might have picked up in the video, there are a lot of relevant documents in the My Health record system which could be useful to your role. There are 3 sources of information that can be entered into the My Health record system. These include consumer documents such as personal health summary and notes, advanced care planning documents, and emergency contact details. There are also Medicare documents such as the Medicare Benefit Schedule or the MBS, the Pharmaceutical Benefit Scheme or PBS claims, and also includes the Australian Immunisation Register, which is particularly useful with our upcoming flu season. There are also provider documents which are uploaded by your healthcare providers, such as shared health summaries, discharge summaries, pathology reports, event summaries, prescription and dispense records, and specialist letters. Utilization of these documents in the My Health Record system benefit both the healthcare providers and the patient. The potential benefits of the My Health Record can be seen in three key areas: the overall health sector, the healthcare provider organization, and also for the individual, on an individual level for the patient. The benefits for the healthcare sector are improved continuity of care, reduced duplication and wasted resources, and streamlined information into one secure location. For healthcare provider organizations like yourselves, you can benefit by reducing time spent gathering health information, improving decision support, and saving time in emergency situations. It can also benefit you by facilitating the validation and verification of clinical information, avoid adverse medication events, and provide access to allergy information to improve continuity of care and inform end-of-life care. As for each individual, they will have improved and informed self-management of their own health conditions. It also allows prompt access to key health information in an emergency situation, secure, convenient access to health information, and less of a need to remember key aspects of their medical history and medications. Adding value to clinical practice through My Health Record is a great digital tool containing a range of information that can support clinicians, improve patient outcomes, but you may still be wondering, how can it add value to your clinical practice or facility? Well, let's have a look at an example. We know that we can access the medication and allergies information in the medicines view, and this provides key information that can help facilitate medication reconciliation tasks, and this in turn plays an important role in reducing potential medication errors. Another example is having access to a resident's medical history via the shared health summary view. This can facilitate assessment for healthcare staff, saving them time having to collect necessary information or having to rely on the resident's ability to be able to record their medical history accurately. Remember, the My Health Record is not designed to replace other sources of information available to you, but rather to enhance the information available. Also, My Health Record is a great platform giving residents and patients the ability to share information such as the advanced care planning documents which clinicians can access to be able to understand and comply with their end-of-life care. I'm now going to present another short video, this time showcasing a case study that illustrates the importance of My Health Record in everyday practice, particularly for elderly patients. It also highlights how the My Health Record can facilitate multidisciplinary collaboration among healthcare teams to deliver optimal patient care.
Caleb Derrington is an 88-year-old male who was living independently at home until he had a fall and fractured his neck and femur. He was taken to hospital in an ambulance. Staff in the emergency department accessed Caleb's My Health Record to gain an understanding of his overall health. In hospital, he had a total hip arthroplasty and remained under their care until he was ready for discharge. After consulting with his family, together they decided it would be safer for him to live in a residential aged care home. The nurse admitting him to the residential aged care home reviewed Caleb's discharge summary, medicines view, shared health summary, and immunization documents in his My Health Record. The residential aged care home arranged a telehealth consult for Caleb to see his GP. During the consult, the GP prescribed some medicines and sent the prescriptions to his active script list. She then sent a pathology e-request for HbA1c. Caleb was pleased that he did not have to leave the home to see his GP. The pharmacist accessed Caleb's My Health Record, reviewing his medical history and medicines information to gain an overall understanding of Caleb's health and medication status. He dispensed the medicines from Caleb's active script list, and the pharmacy then delivered Caleb's medicine to the residential aged care home.
Similarly, we also have another video which showcases the use of the My Health Record in allied care health settings.
You can only get so much from a patient in terms of information. They're not medical experts. They sometimes can't remember the specifics of little things that have happened with their injury that we might need to know that can influence their care. If I'm seeing a patient who's seen a number of different practitioners, it's sometimes difficult to try and collate all that data to get your own treatment plan together. My Health Record can really assist in ensuring continuity of care if someone were to move or if they were to see a different practitioner. All of the data that we've collated can be in that one spot and easy to access.
It's great to hear that there are so many features available in the My Health Record, but how can we access it? Before we dive into this, there is some background information to grasp onto with regards to the software that's being used. Within the field of digital health, there is a government-funded entity that owns the My Health Record system, which is called the Australian Digital Health Agency, or as we refer to, the agency. They work closely with us, the PHNs, with regards to digital health initiatives and are currently working with industry partners and software vendors. Healthcare providers are able to access the My Health Record system through what's called a clinical information system conformant with the My Health Record. In an aged care setting, examples of such softwares include LeeCare, iCare, Health Metrics, and so on. Software vendors can achieve software conformance through an industry offer, which is well recognized amongst most aged care software vendors as it is currently in the pipeline. As for allied health software vendors, this initiative is still currently in the planning stages. However, there is potential for industry offers in the future to ensure My Health Record conformancy is achieved across the board. So that brings us back to the original question. How can healthcare providers access My Health Record? On screen, you can see that there are two ways in which a healthcare provider can access My Health Record. Option 1 is via the clinical information system conforming with My Health Record. To do this, each organization will need to register with the Healthcare Identifier Service. Their authorized staff are then able to view and upload information to My Health Record via their conformant software. For a list of software vendors which are currently conformant, this will be shown as the link on the slide which will be given after the webinar. But this is also available on the Digital Health Agency website. But what happens if my software is not conformant? Don't worry, we still have option 2. Authorized staff can still access the My Health Record via the National Provider Portal, which is a viewing-only platform, and this can be done through your internet browser. This will be the case for most allied health providers as there is no clinical software conformant to My Health Records for allied health professionals at this stage. While the National Provider Portal is limited to viewing only, it still remains highly valuable as it provides insight into your patient's medical history. Through the first aged care industry offer, there are 13 aged care softwares which are My Health Record conformant. In the second aged care industry offer, which commenced in January 2024, the agency is currently working with 9 software vendors to achieve conformance with My Health Record and the Aged Care Transfer Summary, which used to be known as the Yellow Envelope. This will facilitate the upload of advanced care planning documentation to My Health Record. Within our CESPHN region, we have 95% of residential aged care facilities which are computerized, and 86% are utilizing conformant software. Primarily, the main software used across our region includes Health Metrics eCase, LeeCare, iCare, and Autumn Care. Even though we have a large percentage of RACFs using My Health Record conformant software, only 35% have actually registered to the My Health Record. Given that we have discussed many features and benefits to using My Health Record, can you see how this system can benefit your everyday practice? It is worth something considering and speaking about within your organization. If this sparks your interest, we will leave some details in a future slide on how to start the registration process. There are a lot of questions which arise in regards to the privacy and access controls in a consumer's My Health Record. As this is a consumer record, the consumer or their nominated or authorized representative are in control of what's in this My Health Record system. An authorized representative may be someone with parental responsibility, a carer, family member, a legal guardian, or someone with enduring power of attorney. Whereas a nominated representative is a person you or an authorized representative invites to have access to your record so they can help you view or manage it. This means that a patient can choose to restrict access to specific documents in their My Health record. They can also restrict access to their entire record, and they are able to remove documents at any time. They can also be alerted when a health provider accesses their My Health record, which means that all instances of access to My Health record is monitored and logged. As a healthcare provider, it is important to note that there is what's called an emergency access provision. This can only be used if the healthcare provider reasonably believes that there is a serious threat to the life, health, and safety of an individual, and that it would be unreasonable or impracticable to obtain the consent of the healthcare recipient. Alternatively, this breakthrough access can also be used if the healthcare provider reasonably believes that access to the record is necessary to lessen or prevent a serious threat to public health or public safety. Understanding these features allow consumers to understand and provide input into their own My Health record. It is also useful for carers to understand, especially those looking after the elderly, consumers with multiple or complex health conditions, and consumers who are digitally immature or those who have a language barrier. Hopefully, throughout this webinar, you can see that the My Health record currently holds a lot of crucial health information which is beneficial to your everyday practice as a healthcare provider. Current features such as advanced care plans, goals of care, and the aged care transfer summary are very beneficial to aged care providers. We can hope to see more features being added, such as the residential care transfer reason, residential care health summary, the residential care medication chart, the integration of My Aged Care with the My Health record system, and even booking services through the My Health app. As My Health record progresses with improved features and enhancements, CESPHN will have more education sessions available to keep you up to date. Lastly, I would like to touch briefly on the My Health app. So the agency has developed the My Health app designed to encourage consumers to easily access their health information in the My Health record on a mobile device. The app has had a soft launch last year and is a free app available via the App Store or Google Play. It allows users to view the information, download documents from the My Health record onto their mobile device, or even share documents that contain their health information with other people or organizations. If your organization is not yet connected to the My Health record, your patient or resident may be able to use the information on their end through the health app and show you their list of medications, summaries, test results, or even share a document using the mobile device during a consultation. Here is a snapshot of the app's home screen, which lets consumers access information and documents, including those that the consumers or their representatives and healthcare providers like yourselves have uploaded to the My Health record. As we mentioned previously, there are three sources of information or documents which can be accessed, which are the clinical documents, the personally entered information by the consumer, and Medicare information. If you would like to find out more about the My Health app, feel free to reach out to us after this session, as there are a great number of resources available to you, your patients and residents, and also their family. I will now hand back to Priyanka, who will give you more of an insight into CESPHN's latest initiative for allied health professionals.
Thanks so much, Carol. That was a very informative session. As Carol mentioned, the Allied Health Digital Readiness Issue Paper highlights the importance of allied health professionals transitioning from manual processes to digital platforms. Recognizing this role that digital health initiatives play, the Central and Eastern Sydney Primary Health Network is taking a significant step embracing the change. This year, CESPHN is launching a pilot project to encourage the allied health professionals to adopt digital solutions, offering 10 free licenses for the CoPlus clinical information system. CoPlus comes integrated with secure messaging, making it user-friendly and cost-effective. In this pilot project, CESPHN will also assist the allied health professionals with the My Health record registration. So if this is something that interests you, you can check the details on the CESPHN website. Thank you all for joining today, and we understand it's been an intensive session. So if you have any questions or comments, please pop them into the chat box. So if any questions arise after the session, you can contact me or Carol on the details on the slide. And we have also included the agency contact email should you wish to begin the registration for My Health Record for the RACFs. And if you are an allied health professional and interested in registering, please reach out to me directly. A special thanks to all of you for attending. And a reminder, please complete the online survey that'll pop up on your web browser, as well as the post-training survey that'll be emailed to you following the session. We look forward to seeing you again.